Hospitals in the mid-state continue to deal with a lot of COVID-positive patients. Doctors are starting to identify patterns and have simple but important advice for everyone as this surge continues. Brian Munoz has the story from Lancaster.
The pandemic is constantly evolving. Critical factors change by the day. Dr. Michael Ripchinski from Lancaster General Health says at a time when there's a lot we don't know, he does know this.
We're running basically just over 90% Omicron. So it is here, definitely present by the sampling that we're doing.
Ripchinski says out of LGH's patients hospitalized with COVID, about 3/4 are unvaccinated. And out of the rest, just 2 to 3% are vaccinated and boosted.
Booster does reinforce that protection, and that's why people who are boosted are getting mild illnesses. And as you heard, less than 5% of the patients admitted at LGH who are boosted are here.
Dr. Ripchinski also says he's starting to see people who are vaccinated but not boosted having worse symptoms as their immunity begins to wane.
They have, I'm laid up for a week, like flu symptoms. Despite being vaccinated, they may not make it to the hospital. That's not an uncommon thing at this point from the data we're seeing.
He also addressed the changing CDC guidance on how long people need to isolate or quarantine if they've been infected or exposed.
It says if somebody gets sick, it's 5 days, plus day 0 being the first day of symptoms, plus 5 days. Keep them home. That would be the best way to protect your coworkers and your employees and keep your business running.
Ripchinski says at this point,
if you get cough, congestion, runny nose, headache, scratchy throat, hoarseness, you probably have COVID.
And while you're at it,
say thank you. Say thank you to a healthcare team member, a family member that's helping in this pandemic. Just be grateful for all the work that they're doing.
In Lancaster, Brian Munoz, ABC 27 News.